Thank you so much, Findacure, for having me today. So I'm here to talk about improving engagement with people from ethnic minority communities and access to genetic services. And I'm sure you've heard a lot of information already touching on this topic, so I'm going to go into a bit more detail today. Okay, so I'll talk a little bit about how breaking down barriers came about, some of the impact we've had, some of the organisations that we've worked with, and what we hope to carry on achieving. So the initial project started because of Alström Syndrome UK, which is a charity. They only had 3 known families coming from BME communities, and all the people that they were supporting were from white British backgrounds. Looking at the statistics, they were thinking, well, this is a recessive condition. We should have a lot more families coming from diverse backgrounds. Why aren't they engaging with us? From then was created the Asian Mentoring Scheme. Now, the Asian Mentoring Scheme was a project looking at how to engage the BME communities and what could they do as a charity to start being more inclusive. They found that it was issues such as consanguinity, which is close blood relative marriage, and close community marriage, that was causing issues in terms of stopping people from accessing support services. So they wanted to design the Asian Mentoring Scheme to try and raise awareness of Alström syndrome, and this was quite successful, and then we managed to secure some funding from the Sylvia Adams Charitable Trust. From then, we went to breaking down barriers. Now, from the start of Asian Mentoring Scheme to April 2019, you can see there's a vast difference in the people who are now seeking support from the charity Alström Syndrome UK. As you can see, it's not just majority white British. We have a vast amount of different populations and communities coming towards us for support. So we learned a lot from the Asian Mentoring Scheme, and I'll do my best to answer any questions later on about this scheme. This was before my time. I'll do my best. So first, they found that the name of this project, Asian Mentoring Scheme, wasn't really what they were hoping to achieve overall. It was obviously not diverse to other communities and populations, and they also found that getting the kind of staff that they wanted was also an issue. That it's not just about hiring a South Asian community worker to go out in that community and do the work. It was about finding somebody who had the correct skill set, the correct background, the correct knowledge, to be able to actually do everything that those communities needed from them. We also found that it was parents and not professionals who actually had more of an impact in engaging families from different communities. Again, it was that connection between a family that was finding it difficult to engage to having also the knowledge about the genetic condition that was having more impact in connecting with a family than any professional would. As you can understand with any rare condition, because the knowledge is so slim, and as Mike Kane previously said, random in people that you meet. So having both of those and connecting as a mother or as a parent was really impactful. We also found that our trustees, our board, was not representative of the communities that we were trying to serve. And I just want to bring to your attention at this point that Alström syndrome is an ultra-rare condition. So obviously we're not looking to support thousands of people within the population. We then went on to see how could we improve as a charity to what we're offering families. What do we have to offer? If you don't have a list of gains for the family are not going to suddenly become less reluctant to engage with you. We also found that language was a big issue for us. If, let's say, one of the couples or the parents of a child affected with a genetic condition couldn't speak English, that parent was basically disregarded in any medical communication or doctor's appointment. And often it would be the mother or the caregiver in that sense. So if they're not understanding what's going on with their child and they're the one that's the caregiver, then it is going to be difficult if you're relying on your partner to do all the translations for you and they weren't giving the accurate information. So this was another issue that we found at the start. So we also found that when planning events, things like avoiding key dates, don't plan an event on Diwali, don't plan an event on Eid. It's not going to be that great in terms of engagement and inclusion. We also found that you want to develop an understanding of what the issues were within these BME communities. So the practice of consanguinity, so marrying within the family. That was also an issue because of all the stigma and controversy in the media. It actually stopped a lot of families from coming forward and seeking support, which was shocking. And this was stopping them from speaking to medical professionals and instead seeking advice from religious leaders. And from the Asian Mentoring Scheme and from the success of that, we then created Breaking Down Barriers. So Breaking Down Barriers is aimed at facilitating patient organisations and support groups to join together and share examples of good practice and develop new guidelines to highlight effective ways to support families who are at an increased risk of having children with a genetic condition, but who are unlikely or unable to access mainstream services. Now, I can see all your faces. That's quite a loaded quote to explain breaking down barriers, but I will break that down and try and explain it a little bit further. So what we do is how can we get these organisations to come on board with becoming more inclusive and developing this into their policies, their thinking, their marketing, their practices? How can we make it important for these other small to mid to large charitable and support organisations to get involved? And we thought, okay, let's give them some money. Let's give them some money and let's give them some support and let's give them some guidance and let's see what happens. And the best thing about this project, and this is talking from an angle as a staff and as a person who's also been a fundee of the charity, is that it provided you with a network, with a community of really passionate individuals who all created charities, who sometimes they were often parents themselves of children. And all they want to do is help people. But giving people the confidence and the tools to be able to do that changes everything. And that's what we wanted to do. This is some of our advisory groups. We have some really amazing expertise from all varied backgrounds on hand to help us. They attend our workshops, they're on call for any of our charities, any of our organisations, if they want advice from them one-to-one. So in the first 2 years, we supported 15 charities, and these are some of the charities to note. So we had, like I said, small to medium to large. We had EDS UK, Alström Syndrome UK, Luton Parent Carer Forum, Hemochromatosis UK, Genetics and Well Child. A little bit about me. So I am the Community Engagement Manager for Breaking Down Barriers. And I had a passion for genetic counselling since the age of 16. And you're probably thinking, wow, you must have been a really, really sad child that you started that young about thinking about your career. I was a really sad child. I was very studious. But what it was for me is that my mum and dad were first cousins. And I had a brother who passed away at the age of 6 who was microcephalic and also had severe learning difficulties. Somebody told my mum, the doctor told my mum, that, oh, it's because you're married to your first cousin that your child is ill and consequently passed away. She never sought support. She never went to any medical professional after that, and she just always had a mistrust in general. So I went into this field because I thought I don't want anyone to feel the way my family or my mum felt, for anyone to have that kind of service because of misinformation and just not caring enough to explain to someone. So then I went on to doing genetic counselling at Cardiff and went on to Great Ormond Street and UCLH to work as a research genetic counsellor. I worked on the SWAN UK project at Genetic Alliance UK, and then I became the helpline and medical liaison manager for Ehlers-Danlos Support UK. It was through EDS UK that we actually were a fundee of Breaking Down Barriers. So we were one of the charities that took the 5,000 grant to facilitate a project to become more inclusive. Me being Asian probably led for me to lead that project. I think that was probably one of the influencing factors, and it did make it easier. So then I devised I devised a plan to go around 43 places of worship in the East London region. That included Sikh temples, Hindu temples, and Muslim mosques. I also hosted an event at East London Mosque where there was around 5,000 to 1,000 people attending Friday prayer, to disseminated our information, and we also translated that information into Hindi, Urdu, and Bengali, because we found that according to statistics that the South Asian population were more likely to be affected by Ehlers-Danlos loss, which is a connective tissue disorder. So that's how I came to work with breaking down barriers, and then started working with them as their community engagement manager. So when I work with all these organizations that we fund, I can see from their perspective how it is to be a fundee and also how to advise them being a funder. Right, so further to this, my role is to support and assist our member charities in successfully engaging the BME community to create, expand our network and platform of resources and professionals to carry out our aims, offer training in genetics, making complex concepts simple. But I will be honest, there's so much expertise on our panels that there's so many people on our team that do that, and it's fantastic. Also a South Asian language aid. A lot of our charities, because of confidence, they just want to know what are the do's and don'ts when stepping into somebody's house, what are funeral proceedings in different cultures and religions, what can you tell me about that? So I would offer help there. It's basically to try and build an all-round better service for all BME communities. What we found was there were quite a few stigmas and barriers for our families when not engaging with all of these charities that we were funding. We found that they felt judged and stigmatized, or because of their socioeconomic status, or how Sharon over here mentioned before, in a sense it can be a postcode lottery depending on where you are and what services you get access to. So things like that, how could we make things more equitable for those who felt that they weren't in a good position? We also found that the use of interpreters in some places weren't that great. So when you hire an interpreter in a hospital, you expect them to be able to do the job. However, if they don't have a medical understanding, a medical background or a genetics background, and sometimes the word to be able to translate that medical word into that language, you are not getting that information across accurately. And you have no idea, not speaking that language, knowing what's actually going forward for that family. So how are you supposed to know? What's going to help in that situation? We also found that these BME communities, they tended to miss clinic appointments. They tended to not understand the really, really difficult genetic information because, again, possibly language barriers and also previous negative experiences. So what's happening now and what's going to happen? So we've done kind of well these first 2 years, so then Sylvia Adams decided to allow us to fund another 15 organizations, and now we are funding 30 charity and support organizations across the country, and I have no doubt that we will continue to grow. We've now got to the end of our 2-year evaluation report, which I will bore you with the details with later on in the presentation. Actually, we're really, really proud of that. It's a 73-page document of everything that's happened with all the 15 organizations in the first step of our process. For the future, we're hoping to work with NIHR. We are involved with them. We're getting recognition from NHS England. We want to inform policy and practice across the whole board for rare diseases, and we'll continue to monitor and evaluate. So this is now our 30 charities that we are now funding across the UK. There's big ones like UK Thalassemia, the Cystic Fibrosis Trust, Hemochromatosis Society, Huntington's Disease Association, Alkaptonuria Society. Some of these charities actually have a stand upstairs, which is really lovely. Okay, so how we deliver the project. I'll rush through this. So the charities come to us with their expression of interest. We will research the organisation. How do they look on the Charity Commission's website? Who's giving them funding? What's their organisation like as a whole? Do they have diversity within their staff? What's their information like on their website? Is it palatable? Is it easy to understand? What are their resources? And who are they currently engaging? What's their demographic? We also offer face-to-face guidance, helping them design an action plan for them to carry out for the year with the funding. We actually do a lot of hands-on work with every single organisation that we work with. We also get our staff and advisory board on hand to work alongside them. So if you want specific advice regarding a specific area, we will put you in touch with either charities that are doing similar things or our advisory board that can directly advise you on that. What we aim to do is a consultative process where we are building you up as an organisation from a starting point, giving you further awareness, collaborating and pooling resources if there are similar symptoms across the charities that you can share, and just trying to spread the voice about genetic awareness and rare diseases. Okay, so when our organisations fill in our action plan forms, we expect them to fulfil at least 2 of these breaking down barriers outcomes with their plans. So I'll leave that for you to go to have a little look at. Okay, so in terms of the first evaluation that we have done, funding 15 charities over the first 2 years of the Breaking Down Barriers project, what we found that there was not one single approach that could be generalized over all 15 charities. Every single charity had their own individual project that was suitable for them, their demographic, the size of their organization and what they were hoping to achieve, and also the community that they wanted to engage. We also wanted to make sure that the charities were at a particular starting point before we went forward to support them. If they didn't have their databases developed, they didn't have their internal processes developed, do they have paid staff? Are they able to manage facilitating this project? So we had to look at lots of things like that, and if they weren't at that level, we would help facilitate them to get to that foundation point to then offer funding and go forward. We also wanted to link them with their target community. So if there was one family or 2 families that they had engaged, speaking to them, holding focus groups, asking them, why aren't other families possibly engaging from ethnic minorities? What do you think it is that we're doing wrong? We also really wanted to link all of our charities with an NHS. Do they know all the doctors that are working and doing clinics across the country? Are they engaged with them? Do they know about the charity? Do they have their information? So we wanted to make sure that they had an all-rounded understanding of everything that was going on relevant in the country. Okay, so some project examples. So Genetics is a charity that offers free genetic screening in schools and universities. Now, genetic screening for common conditions within the genetic community, within the Jewish community, for BRCA1, BRCA2, metabolic conditions like Tay-Sachs. And they were going into the schools and offering kids as young as 16 panel testing for these common Jewish conditions. And what they found was they were educating kids, they were educating their parents through this. They were also informing kids of their carrier status for their conditions. So when they met their partner or the person that they wanted to have a baby with, they would know what their standpoint was and give them the appropriate genetic counselling throughout that entire process. We've continued to fund them. There's also Wolfram syndrome. They decided to translate some of their information and put one language side by side to English. And I just think this is such a fantastic example of when translation can work and when it can work well. Well, as you can see, the marketing and the colours are fantastic. They're engaging, and both languages are side by side, and the English is really simplistic. Because what we were finding with that, a lot of our even white British families who were using the charity's websites for medical information, they were going to the children's parts of the website to read the medical information because it was more palatable than all the other gobbledygook genetic stuff in the main parts of the website. So we were always trying to promote, trying to make the English simpler for everybody, trying to make the language as less medicalized as possible so it engages everybody. And they did this really well. Okay, so what did we learn from working with member charities? So many charities, what was the learning? So what we found was overall there was a lack of diversity within majority of the organizations that we funded. And that lack of diversity then led into a loop of lack of confidence and feeling like I don't really know how to engage these communities because I don't want to offend anybody. I don't know what language to use. I don't know what's appropriate. So we found that it just became a loop of fear. And that's what we are here to address. We always have a really open policy with breaking down barriers. Whatever you want to ask, however you want to ask it, we are here to answer those questions for you. If you want to know about funeral arrangements, if you want to know about wedding arrangements, if you want to know about how to enter somebody's home from within the traveling community, what do? You can ask us. What we also found that creating audio and video resources was a really great way to go, no matter what languages you were using, no matter what you were doing, as long as you showed diversity on your website and on those videos, it really worked for engagement. It was much better than translating written information. We also found that there was a general culture of us and them. So it was more about they are not engaging, so we're just going to carry on and we're not going to do anything about it. It should be that there is no us and them. Why aren't they engaging? What can we do to better our service to help the BME community engage, all these families that need support to engage? It was more about trying to have a collective understanding about equity. And I think the most important thing about breaking down barriers is that we want people to learn from the funding that we're giving them and the consultation that we're giving them to then put that into the backbone of their thinking. This should inform all of your future work, all of your future policy. It's not about taking funding for 2 or 3 years, walking away, clapping your hands and saying we're done. This should inform everything that you are doing. You can't engage families and then suddenly not be interested anymore because you're not paid to. It has to be part of your marketing strategies, part of your information, part of all of the events that you're doing and the thinking behind that, because it is important, it is equity. We all deserve healthcare and support for all of our problems. We also really wanted to try and empower our charities to be confident enough to handle issues like consanguinity, handle difficult questions like, am I going to be judged for this? Will the rest of my children have this problem? How can I make decisions about my future pregnancies? I want to talk to my religious leader instead of you. Giving them the confidence to address all of these situations in the most respectful manner. There needs to be more culturally aware, trained professionals. Professionals from different backgrounds who speak different languages, who have different understandings about genetics, health and medicine, to be able to go out and do outreach work, because they are the ones that are going to educate the communities. They're going to engage the communities, and there is a lack across the whole of UK of culturally trained, aware professionals. It is through education that families can be aware of genetic conditions and services and family planning options, which in turn reduces cost to the government all around, because everybody's making an informed choice. Everybody's understanding what's going on. They know where the services are that they should be accessing. Right, final thoughts. Breaking down barriers, I believe, can play a vital role in bridging the gap between families at home and health services. Breaking down barriers promotes the importance of patient organisations. It empowers all different sizes of patient organisations. We all know the situation at the moment with there being so many cuts to the NHS, and all the services are struggling. All of our nurses and doctors are struggling. On top of that, we have our genetics team and the genetic counsellors and all the outreach work that they used to do, but now due to funding cuts and lack of capacity, they are not doing that as much. Therefore, all the kind of pressure is falling onto the voluntary sector. And we need to be that bridging of the gap. We need to be that bridge between the voluntary sector and the NHS, clinical services, pharma, politics, to be able to say, this is what we can do. This is shared examples of what we can do. These are examples of good practice, so we can support everybody. The voluntary sector can't take all of this offload from the NHS if they're not funded, if they're not equipped to do so. So this is the best way forward. We also form partnerships with the NHS to try and work the best way for patients. We give patients that voice, and we allow them to inform what we're trying to do every step of the way. We believe that collecting national examples is going to be the way forward, because we can say, look, it's not all talk anymore. There's not thousands of research papers that are saying the same thing, that we need to do more to be more inclusive. We are actually giving proven examples. We're empowering families to understand their condition and make informed choices. And we really hope that, considering the population of London, Manchester, Birmingham, Glasgow, how diverse they are, how diverse we are as Great Britain, more should be done within the NHS to start taking this more seriously, to be more inclusive. So that's what we hope to do. Thank you, everyone.